It's a pretty lengthy explanation. I'll try to be brief. There's been a lot of a debate about what causes Alzheimer's. Particularly, they look at the cells within the brain in which plaques develop in between neurons, which then prevents the actual neuron or brain cell from firing. And if something's not firing, the cell or neuron actually will die. So what really is cell death in the brain caused by these plaques and tangles. And that really is sort of what the main conceptualization of what brain Alzheimer's is about. Primary warning signs of Alzheimer's is actually memory loss. And we're not talking about memory loss in terms of your birthday or how do you sing happy birthday. Those are things that are pretty much cemented in our brain. What I mean by memory loss is the short-term thing. What you were doing when you were walking in and had a conversation with somebody the hour before, what that conversation was about. Those are really the main warning signs of Alzheimer's. So the one thing that somebody should initially do when they feel like they may have Alzheimer's is to talk to people around them and see if they've noticed. What is the common theme with Alzheimer's is that people around you will tend to notice more than you do. There's somewhat of a loss of insight, especially in the later stages. So what you want to do is, one, talk to people around you, see if they've noticed, especially your loved ones, people that are close with you, that see you throughout the day, and also people that have known you in the past. What you would do from there is talk to your physician, talk to whatever medical provider that you can get a hold of, and speak with them about the warning signs. Speak with them about what you see going on. And a good tip is always, I tell my patients, is to write things down that they notice, because oftentimes when you get to see a physician or a neuropsychologist or somebody, you will forget what the details are of what you are trying to remember. So if all else fails, speak with your physician about it. Come to clinical trials and take part in one of our free memory screens. This is a screen that's done by myself. I'm a neuropsychologist, board certified, and what you would need to do then is schedule an appointment to see us. This would allow you to establish also a baseline should in the future you want to recheck it in a year or two to see how you did. So comparison of two data points is always the most helpful for any kind of clinicians who are potentially diagnosing you or attempting to treat you. If you think about it, Alzheimer's is the 5th leading cause of death for people ages 60 and over. And if you look at the statistics for money that's spent, in 2014 there was over $200 billion spent trying to figure this out. So where you stand with that is, if you have concerns and you want to ask somebody more questions, you can always come in and you could speak with us, because what we're doing here is being part of the new up-and-coming research for medications that are potentially acting on the processes in the brain that will be associated with Alzheimer's functioning. So what I mean by that is, with the neurons in your brain, which again are the cells that are related, that are inside, you will take a medication that will be then looking at the degrees of difference in those cells throughout time. Free memory screens that we give here at Clinical Trials of Texas would be most appropriate for people ages 50 and above. These screenings would be about 30 minutes long, and it would be helpful if you brought somebody that can kind of comment on the symptoms or the concerns that you currently have. And what we would do is basically measure the changes, should you have any, should you want to get a future screen in a year or so. So establishing baseline is most important, particularly if you're over 50 and you are somebody that has a family history of dementia or memory problems. Those would be the persons or people that we would feel like would benefit most from these free screenings. So give us a call at Clinical Trials of Texas if you're interested in one of these free memory screens. If you give us a call, you will speak directly to one of our recruiters, or you also have the option to look at us online at saresearch.com, whereby you could apply online to sign up for one of our memory screens.